Many people don't go to therapy, and part of that is not understanding what takes place in therapy and trying to encourage people to understand it's not a big deal. If you go there, they talk to you. It's not like you would see in the movies. You sit on the couch and they say nothing. They should be interacting with you in the process, and part of it is what they're thinking. What do they think is going on? What do they think we need to do to try and address that? In many cases, many therapists might give you homework assignments of various sorts to try to help you either identify your mood, or be it anxiety or depression, or it could even be possibly suicidal thoughts. And at times they give you homework to try to enhance skills in terms of, so you know how to handle it when you find that you are anxious. What do you do? If you find when you meet with someone you think it seems to be a good match, continue. If you find for whatever the reason, legitimate or illegitimate, I don't like this guy or this woman, there are many other therapists out there. What we find at times, people go once, it's an unhappy experience, so they stop. I won't go anywhere because I didn't like this. The answer is no. You go to a car mechanic. You don't like the guy because he does a lousy job. You go to a different one. But I think you have to be open to the process. Part of the process is a therapist might ask you uncomfortable questions trying to learn about you. And you might feel uncomfortable answering those questions, whether it's about suicide or whether it's about other traumas in your life, things that have happened. They want to understand who you are. And you and the therapist should be clear on what you're trying to achieve. You're there because something's bothering you. They need to help you with whatever is bothering you. There might be more to it than you think. I mean, that's their job, to determine what else is going on, because you might come in and not quite realize that things that happened in terms of when you were younger are having more impact than you think. At times people are afraid, I've heard people say, will my employer know if I go with my insurance? And the answer is they shouldn't anymore. They know you have any other medical illness. It's a confidential conversation, and the employer should know nothing about it, nor should anyone else unless you decide to tell them. Long ago, a psychologist in the 60s, Nicholas Cummings, who looked at therapy as a family doctor. It doesn't have to be continuous. It can be you go for a while, you're feeling better, and you can return. So I think it's important that clients understand that it's not failure if you return to therapy any more than if you go to your family doctor 2 years down the line for some problem. So therapy is you go, if things go well, fine. If you at some point need to have whether it's what would be called a booster session or more therapy, you return.